The member from Ottawa Frontenac Leamington Addington.
Speaker, my question is to the Minister of Health. Minister, Paul Compton and his 5-year-old son Mateo are constituents of mine. Paul is a Canadian citizen. He grew up, lived and worked in Canada for 32 years before taking a job to teach overseas. Last Friday, Paul was told Mateo's OHIP eligibility has been pulled by your government. Mateo was born to Paul and his wife while they lived in Peru and has fallen through the cracks in our health insurance laws. If Paul was adopting Mateo from a foreign adoption agency, Mateo would be covered. If Paul was a foreign worker in Canada on a work visa, his dependent son would be covered. But instead, Paul is a Canadian citizen whose dependent son was born abroad. So we have declined him health insurance. Minister, will you intervene to help Paul and his son Mateo?
Thank you. Minister of Health, long-term care.
Well, thank you, Mr. Speaker. And first of all, I understand that this is a deeply troubling and difficult situation for the family involved. I had an opportunity to speak with the member opposite yesterday briefly after question period and committed at that time to look in to the situation in more detail, which I have done. It is a complicated issue, as the member opposite knows. We've taken the politics out of decisions such as this in terms of OHIP eligibility precisely for this reason. The member understands that the reason for eligibility is due to changes that the federal government, in fact, made with regards to citizenship. But I have committed to the member opposite to follow up on this. I know he's met with my ministry or spoken with the ministry. I would offer a similar opportunity to the family involved to meet with my ministry officials.
Supplementary.
Thank you, Minister. This is a grave situation for Paul and his family. And although there is some elements of immigration laws, it's because of Regulation 552 has not been modified by this government since those changes in the immigration laws. Paul is looking, and his family are looking to you to demonstrate that this government has compassion and integrity. And you surely will agree it is not within the spirit of the law to disallow Paul and his dependent child, Paul, who's a Canadian citizen, and his dependent child health care coverage. Minister, will you act now and make sure that the law is applied as it is intended and that Mateo is covered by health insurance?
Thank you, Minister.
Well, thank you, Mr. Speaker, and I would. I guess I would suggest and ask the member opposite to join me in the understanding that this was a federal decision that was taken legislatively.
It was.
Several years ago.
Member from Nepean Carleton, come to order.
I would invite the member opposite, in fact, to petition the federal government if, in fact, as I take the position, if I disagree with those changes that were made. The fact is that Ontario health coverage is provided to individuals who are Canadian citizens and individuals who are permanent residents. I think that's a fair process. There is a wait period in place for new permanent residents, new Canadian citizens, a wait period of 3 months that has been long established in this province.
Answer.
But really, this is the result of a federal decision which restricted citizenship for those individuals who are born abroad.
Final supplementary.
A follow-up, Minister. We know that when those federal laws changed, your government immediately took steps and provided OHIP coverage for refugees. I have the press release here. You acted, right? Paul Compton and his family is asking you to act in their case, right? It is a fair and just request. And, Minister, I think it's important for us to realize there's a lesson here that that laws that are rigid, lack discretion, and that are applied regardless of the circumstances always result in unjust outcomes. Minister, I'll take you up on that offer. I'm sure Paul will take you up on that offer, but we have met, and we have met. And I've spoken with you, and I've sent letters to your the immigration minister here as well. We have not had any success. It's time to act and change Regulation 552. Thank you.
Thank you. Minister.
Well, thank you, Mr. Speaker. As I mentioned, at the beginning of my first answer that I sympathize with the family involved. The member opposite knows, and I'm happy I have both committed to following up specifically, but I know he's spoken with my ministry. I am happy to arrange that meeting between my ministry and the family involved. But fundamentally, this is something that has resulted from a change in legislation at the federal level, further restricting the ability of children of Canadian citizens born abroad to obtain that Canadian citizenship. And OHIP coverage is available for Canadian citizens and permanent residents in this province, as he knows.
Answer.
This was a federal decision, and I would implore the member opposite to work with me at the federal level to have action
Thank you.
if he believes this is an injustice.